Hello, this is Thomas Smith, and you're watching Channel 4 News. Today, we have a breaking story about a local private school, Bulls. After beating Cocoa Beach 21-14, the Bulldogs advanced to the Class 4A state championship, where they will take on Booker T. Washington in Daytona. But after star wide receiver Chance Moore was infected with staph on his foot, it spread to half the team. Here we have Savannah Friedland at the scene interviewing Chance on the details.
We are here with Chance Moore, local Jacksonville Bulls high school football player. Here are some of Chance's highlights. Get the He and his teammates have advanced to the state championship. Congratulations. Tell us a little bit about this season and how it has been for you and your teammates.
Been a pretty good season. We've averaged about 69 points per game, 420 rushing yards. We have 12 D1 offers, all going to Alabama. And yeah, state championship is next Wednesday. Pretty hyped about it.
That's great. We are looking forward to see how you guys do at the game.
Thank you.
However, you and a few of the other football players have recently been infected with staph from the locker room. Tell us about what happened and how it is going to affect the upcoming game.
Well, I noticed that I had a rash on my foot after the game last Friday, and I went to the doctor and they told me I had staph infection. They put me on some antibiotics, and they said that I probably got it from the locker room. The locker room really smelly and nasty. So hopefully it clears up for the next game.
That's terrible. Have any of your other players been infected?
Yeah, a few of my other teammates also have the infection, but they're on antibiotics trying to get it cleared up. So we're all ready for the game in 2 weeks.
Well, I hope you get it cleared up real quick.
Thank you.
Here's some information about staph and what to look out for and ways to prevent you and your athletes from getting the infection. Staph causes a skin infection of the deeper skin layers, bone infection, and muscle or joint infections. Staph cellulitis begins as a small area of tenderness, swelling, and redness. It can also begin with an open sore. If the infection spreads, patients may develop a fever and there may be swelling in the infected area. Antibiotics or penicillin. However, in some cases, doctors will prescribe stronger antibiotics because antibiotic resistance has become a problem in some cases. About 25% of people carry staph in mucosal areas and have no idea or show no signs or symptoms. The foot is very prone to picking up bacteria from the floor. In Chance's case and the rest of his team, his foot obtained the infection and the rest of his team may be at risk for getting the disease. The most common form of staph infection is the boil. The boil is a pocket of pus that develops in a hair follicle or oil gland. The skin over the infected area usually becomes red and swollen. Boils are very painful and contagious. Staph aureus is a type of bacteria that can spread through the skin or open wound and causes a serious infection. To prevent staph aureus, keep feet clean and dry to prevent fungal infections. Always check to make sure you don't have an infection, and if you notice something, get it checked out by the doctor. Good luck to the team, and back to you guys in the studio.
Thanks, Savannah, and congrats to the Bulldogs on their season. Hopefully, it'll end with the state championship. We now move to Chloe Chavone in the studio with another breaking news story of a second grader, Sarah, battling illness after illness. She initially came down with tuberculosis after visiting her grandfather, but later was diagnosed with chickenpox. Here's Chloe. In the early 90s, over 4 million people were infected with chickenpox and 200 died each year. As a result, the CDC developed the Childhood Varicella Vaccination Program. Since then, the number of cases has dramatically declined and hundreds of lives have been saved. The vaccination is very safe and effective, so you and your loved ones should be vaccinated. If you decide to not get the vaccine, here are some ways to relieve symptoms and prevent skin infections. You can use calming lotion and a cool bath with baking soda and uncooked oatmeal to relieve some of the itching. To prevent the virus from spreading to others and potential bacterial infection, avoid scratching at all costs. Keeping fingernails short may help prevent skin infections caused by scratching and blisters. Do not use aspirin to relieve fever from chickenpox because it has been associated with Ray's syndrome, a severe disease that infects the liver and brain and can cause death. Antiviral medications are recommended by the doctor for those with chickenpox that are at a high risk of developing serious illness. They work best if taken within the first 24-hour appearance in the rash. Thank you, Savannah, and good luck to the Bulldogs. In recent news, local second grader Sarah was recently diagnosed with tuberculosis and has now been infected with chickenpox. Sarah's parents believe she got tuberculosis while visiting her grandparents in an assisted living facility. The disease is spread through the air when someone with active tuberculosis sneezes, talks, or coughs, and the Mycobacterium tuberculosis bacteria droplets are inhaled. Her parents and doctors were very concerned when she was diagnosed with it, and she got the disease from an active tuberculosis patient, meaning that they do have signs and symptoms. In some cases, the lungs may start to fill up with air and fluid, causing the patient to be short of breath and experience chest pain. There is a tuberculosis vaccination available and highly recommended that all Americans get the vaccine because it will help prevent the infection. There are also drugs that can kill most strains of the bacteria. Injectable medications and antibiotics are also available. Sarah's parents chose not to get her vaccinated when she was younger, but since they caught the infection early, she will be okay. Chickenpox is a highly contagious disease that is caused by the varicella zoster virus. It is common for children to get the disease. However, if babies, adolescents, adults, pregnant women, or people with a weakened immune system have the disease, it can be very serious. The first symptom of the disease is a rash, which starts on the chest, back, and face, and progressively spreads to the rest of the body. Typical symptoms include rash that turns into an itchy, fluid-filled blister that will scab. The rash can spread to the inside of the mouth, eyelids, or genital area. It takes 1 week for all the blisters to scab, fever, tiredness, loss of appetite, and headache. The illness typically lasts 4 to 7 days. The best way to prevent the disease is by getting the vaccine, which is very safe and effective. It is recommended that everyone should get 2 doses of the vaccine. The first one at the age of 1, and the second between the ages of 5 and 6. The infection manifests in 2 separate phases, the primary infection and secondary infection. The primary infection is what's known as chickenpox, and the secondary infection is commonly known as shingles, a reactivated strain of the virus in the central nervous system, and it usually occurs in older people. VZV can only infect humans. The varicella zoster virus is a double-stranded DNA virus that belongs to the alpha herpes virinae, a subfamily of the herpes viridae family. VZV infects a human host when the virus particles reach mucosal epithelial sites. Replication is followed when the infection spreads to lymphoid tissues when the virus can gain access to T cells. The T cells are then infected, and then they deliver the virus to cutaneous sites. Sarah most likely got the disease while being in and out of doctors' offices while being treated for tuberculosis. Her parents also chose for Sarah not to receive the chickenpox vaccine either. Sarah's been out of class for 2 weeks now and is expected to be back in class in another week. Her classmates and teacher miss her a lot and can't wait for her to be back in class. It is very important that everyone get the recommended vaccines. Parents also should look out to make sure that if their children seem to be coming down with something, to take their kids to the doctor to have it checked. We hope you feel better, Sarah.